next we'll be focusing on global political movements. We have two presentations within this panel. Global political movements. In recent years, political movements around the world have taken new forms as populations adjust to new facts on the ground. In this panel, we will hear from two student speakers on two very unique global political movements. First, Yash Bajaj will discuss the evolving nature of vaccine nationalism and multilateralism, as the distribution of COVID-19 vaccines presents perhaps some hopeful an end of an emerging end to the COVID-19 pandemic. And then next at 3:20, we will hear from Maria Alexandra de Agostino about the global movement to end female genital mutilation, specifically about a recent policy in Sudan that criminalized the practice. So I'm going to go ahead and begin introducing our next speaker and our next discussant. So I'll invite Yash and Jared to go ahead and turn their cameras on as we get started here. Welcome. So we have Yash Bajaj. Yash Bajaj is a third-year student at the George Washington University studying international affairs and economics with a concentration in security policy. He is from New Jersey and he's interested in the politics of Western Europe and South Asia. He is also working on his fluency in Hindi and in French. Welcome, Yash. Thank you so much for being here. Jared Tucker is a public health consultant at Guidehouse, where he supports the Centers for Disease Control and Prevention. He also holds a BA in International Affairs and Global Public Health from the George Washington University. Previously, he worked as an intern in the Office of International Health and Biodefense at the US State Department, as well as Global Development Lab at the US Agency for International Development. Prior to COVID-19, Jared had been studying African political and health security in Senegal as a David L. Boren Scholar. Additionally, he is working on his fluency in French, Arabic, and Wolof. Welcome to you too. Yash's piece has recently been published on the Onero website, and when we get started with this presentation, I'll put it right there in the chat for you to check out later on. It was a really wonderful piece on, vaccine nationalism and multilateralism, and I've been going over his presentation with him before this, and he's updated it even more because it's such a fast-moving topic. The vaccine rollout continues to happen every day as we speak. So I really want to appreciate Yash. You've been on this every single day, making sure that your presentation is up to date as this continues to evolve. And thank you, Jared, for offering that support. Jared also just recently helped us host an event on containing deadly pathogens. The recording of that will be up soon on the Onero website, and I strongly recommend that you check that out and look out for some more events coming up this year that will focus on such topics in the global health and security world. So now I'm going to begin sharing Yash's presentation, and I think we're going to go ahead and get started for just a moment here.
All right, we're good. Can you guys hear me? Okay. Hello?
You're all good, Yash. Go ahead.
Okay, good. So yeah, hello everyone. First off, I just want to thank Alad, Andrew, and the rest of the Onero team for putting the summit together. And also I want to thank Jared for stepping in as my expert discussant. I know, I just texted Jared and he was on board, so I'm really glad he was able to do this with me. And he's very knowledgeable on the subject, and I know he has a lot to say on the issue, and I'm looking forward to our discussion after the presentation. And so I published an article on vaccine nationalism and multilateralism, and I'm looking forward to talking about it. I hope you guys enjoy. Next slide. All right, so to this day, the coronavirus pandemic has claimed more than 4 million lives. In terms of getting ourselves out of the pandemic, the global community has accomplished a couple of things. One, although there was a couple of waves of infection that caused significant casualties, we were able to quarantine, follow health guidelines, and lower the number of global cases. Two, pharmaceutical companies such as Pfizer, Moderna, and J&J were able to develop safe and effective vaccines ready for global distribution. After the development of the vaccines is where the global community has hit a bit of a roadblock. Current manufacturing capacity and global vaccine procurement does not meet current needs. Current vaccination rates of approximately 6.7 million doses per day translates to achieving herd immunity in 4.6 years. Next slide, please. So herd immunity is achieved, Herd immunity is achieved when 70 to 85% of the total population receives all doses required for the vaccine. And while high-income, wealthier countries have been moving to reopen borders, prepare for greater rates of tourism, and plan for larger events and activities, other parts of the world have faced new peaks in the pandemic and will continue to face a high number of cases. The delivery and procurement of vaccines in some of the poorest nations is still relatively non-existent. And experts suggest that 80% of the population in nations without resources, money, supply chain capacities, et cetera, won't receive a vaccine this year. So here are just a few examples. Next slide. From April to June this year, India was in the midst of a humanitarian emergency. The country's health system was simply collapsing. Hospitalized patients that didn't have access to ventilators and oxygen. There were incredibly high levels of new daily cases and deaths, which led to bodies literally burning on pyres in the streets. And in Africa, there were concerns over a potential third wave of coronavirus cases. According to the WHO, the number of deaths in Africa has risen by more than 40% in mid-July, with the highest number being in Namibia, South Africa, Tunisia, Uganda, and Zambia. They're facing shortages in beds, ventilators, and other hospital supplies. These new waves of cases can be largely attributed to the fact that they're lacking behind in vaccination rates, which a large reason being vaccine nationalism, which explains many inequalities and inequities in global public health. Next slide. So vaccine nationalism, that occurs when governments sign agreements with the pharmaceutical manufacturers to supply their own populations with vaccines ahead of them being available for most other countries. And history shows that countries tend to favor their own populations more than other populations, of course. And during the H1N1 swine flu crisis in 2009, most nations began providing the vaccine to their own citizens their foremost priority, leaving other states more vulnerable to the spread of the disease. In terms of COVID, there has been no stable and concrete global health governance mechanism to deal with the pandemics, and hence most nations have started to take internal measures supporting their own citizens first. Next slide. So far, the scramble for vaccines has been dominated by powerful, wealthier governments who have put billions of dollars into controlling the initial supply through advanced purchasing agreements. The data in the graph here simply shows the disparities in global vaccination rates between the Western world and the global South. Next slide. As of April 2021, 87% of the total doses were administered in high-income countries compared to a measly 0.2% in low-income countries. Like this number has obviously risen a bit as COVAX is rolled out and there have been more vaccines in low-income countries, but it was really bad as of April. It's still pretty bad. It's still very bad. And Canada, for example, just a case study, Canada has purchased enough doses to vaccinate its population 5 times over. Now, the supply of shots in places such as the United States and Canada has begun to significantly outpace demand, where states like Louisiana, Kansas, Missouri, before obviously pre-Delta, they had too many doses for their populations. And overall, nationalist approaches have significantly altered the global distribution of vaccines. Next slide. All right, next slide. So now I'm going to go into some of the multilateral efforts. And since the start of the pandemic, there have been some multilateral initiatives that have emerged. First, in like April 2020, the Access to COVID-19 Tools Act Accelerator was an ambitious project created to speed up the development, production, and access to COVID-19 resources and vaccines. And under the Act Accelerator, you have the big vaccine allocation pillar called COVAX. It's co-led by several health organizations, including the WHO, the World Health Organization, the Global Alliance for Vaccines and Immunizations, Gavi, the Coalition for Epidemic Preparedness, CEPI, and UNICEF. And under COVAX, an alliance of more than 180 countries would pool their resources together and share the costs of vaccine research and distribution. COVAX is supposed to help make vaccines more readily available to vulnerable populations, primarily in low-income countries, like in countries in Africa or South America or Asia, who don't have the same infrastructures as high-income countries. As of August 6th, 2021, yesterday, COVAX has shipped over 188 million COVID vaccines to 138 participants. And now, although COVAX has already made its mark and raised over $6 billion, if you think about it, 188 million is still a very minute amount of doses, considering their goals, their long-term goals of that, and consider there's 7 billion people on this planet, 188 million is absolutely nothing. And COVAX needs another $2 billion this year in funding to reach its distribution goals for 2021. In the past couple of months, high-income countries, including the United States, Great Britain, and France, they've pledged to donate vaccines to low-income countries, but it's still very low amounts that will make little to no difference in ultimately achieving herd immunity. Next slide. Just to go back to an earlier point really quickly, this map shows when widespread vaccine coverage will be achieved. According to research by the Duke Global Health Innovation Center, 4 billion doses have already been purchased through deals involving countries, with another 5 billion doses being negotiated through the same parties. And comparatively, compared to this $9 billion total figure, only 250 million doses were purchased by COVAX in the same time frame. So these figures, along with this map, indicate the prevalence of vaccine nationalism. And at the end of the day, most people in low-income countries will be waiting for vaccines until 2023 and 2024 if current trends continue. Next slide. Now I'm going to go into some of the consequences of vaccine nationalism, as well as the importance of vaccine multilateralism. Next slide. And essentially, the bottom line is that vaccine nationalism has left poorer nations with tougher choices, and they have been left in dire conditions. Next slide. All right, so this is like a lot right here. Vaccine nationalism has had problematic ripple effects. First and foremost, letting a majority of the world go unvaccinated simply increases the death toll each and every day. It also results in higher hospitalizations, leaving healthcare systems, especially in those in low-income countries, overwhelmed for years to come. Second, as we've seen with the Delta variant very recently, remaining unvaccinated people will help spawn new virus mutations that could possibly be even more contagious. New variants could result in vaccine resistance and infect people who have already survived the virus or received multiple doses. And the Delta variant is a clear and very strong example of this. So a little bit of background, the R0, which is the infection rate of 2020 COVID, was 2, which means that for everyone who gets COVID, there was a high likelihood that they would infect 2 other people. The problem with the Delta variant is that the R0 is, I believe, 8 or 9, which means that you could potentially infect 8 or 9 other people if you get infected. And that is exponentially greater, which is why most of the cases you see today in the US or most other countries are because of Delta, because of the spread is a lot greater than other variants or the Lambda or the Alpha or 2020 COVID was. Besides Delta, there have been infectious variants in Brazil, South Africa, and India. And the more people that new variants infect, the more likely is that further mutations will occur, increasing the likelihood that the virus can evade the immune response set out by the vaccinations in the first place. Furthermore, uncoordinated supply chains and health infrastructures could magnify the risk of escape variants, leaving all nations in the same situation we were in a year ago. And I'm pretty sure we don't want that. And additionally, with the vaccine nationalism, there's a greater likelihood that COVAX will face greater shortages in supply. And for example, when India was the epicenter a couple months ago, when there was a lack of support from the international community regarding their humanitarian situation, they weren't getting the doses and the support needed from countries like the United States. And then the Serum Institute of India, which is the largest manufacturer of vaccines in the world, they were unable to provide significant doses to COVAX because they had to protect their own population first. So it kind of just goes into that ripple effect of how one situation or being nationalist affects other situations in other countries. So these are all significant concerns of vaccine nationalism. Now into some of the benefits of multilateralism. So I think, as you can see, this is not really a cost-benefit analysis, or just like a cost or a benefit in a way. First and foremost, the main takeaway from vaccine multilateralism is a lower death toll. It's pretty straightforward because more people would be vaccinated. Second, there's some economic benefits. According to estimates by the Eurasia Group, the economic benefits of an equitable vaccine solution by 10 donor countries would be approximately $153 billion in 2021, and that would rise to $466 billion over the next 5 years. And just for reference, the 10 countries that were mentioned in the study were the US, the UK, Germany, France, Canada, Qatar, South Korea, Sweden, and the UAE. So a pretty wide range, but also pretty wealthy countries. In general, COVAX requires less money and funding, and vaccine multilateralism would increase the output of the global economy, which is the primary reason why you see these benefits. It would help various sectors, including tourism, education, manufacturing, transportation, and even oil and gas production. The pandemic will cost the global economy $11 trillion in output before the end of 2021, and this number is expected to grow to 28 trillion by 2025. So if lockdown measures continue due to low vaccination rates worldwide, the global economy will continue to suffer. And next, the next point I have here is vaccine multilateralism is also really important in supporting global supply chains. The world depends on global, not local, supply chains, and worldwide vaccine distribution requires the collaboration of various companies and partners located in different parts of the globe. Next slide. The left picture, sorry, next slide, Alad. Sorry. So the left picture shows a couple of the distribution processes for the processes for the vaccines, and the right picture shows freezer farms, which are cryogenic containers for shipping and storage that often use liquid nitrogen and cooling. Vaccines, they need these freezer farms in order to stay cold and viable for use. And unfortunately, many low-income countries simply do not have the infrastructure to support this freezer farm technology. And they simply depend on the help of wealthier nations in order to, support their own populations with the vaccines in order to store them. So, and these are just a few, yet some of the most important reasons for multilateralism on the road to achieving ultimate or herd immunity. Next slide, please. I just wanted to quickly touch on the potential hybrid approach that embraces both vaccine nationalism and multilateralism. And this isn't a perfect example, but look at what Joe Biden did at the G7 summit. He announced his plan for the United States to share vaccine doses with the rest of the world now that a greater portion of the national population was vaccinated. And simply put, you can accomplish your nationalist approaches and meet vaccine requirements without disregarding the vulnerability of other global populations. And Western nations can pledge to make their excess doses. For example, in Canada, there are 5 times if you have 5 times your population, the amount of doses as your population, you can use 3 times those doses and give it to developing countries through COVAX. You can use those excess doses and portion them and give them away. So in the end, we basically just need more collaborative efforts across the globe in order to reach some sort of level of normalcy everywhere and not just in a certain part of the world. Next slide. And just in conclusion, go to the last slide, please. I just want to point out that I see this pandemic as a critical point for future global cooperation. It serves as an opportunity for improved global governance and health systems. And in today's modern GX world, it's not a G7. It's not, there are a lot of players, with a lot more actors than there were before. Networks and partnerships are essential to solving global issues, such as the delivery of vaccines. And focusing on vaccine multilateralism and other multilateral efforts will help pave the way for a brighter future and ultimately overcome some of the nationalist tendencies that we see today. Thank you. And now I'm going to turn it over to Jared, who has a lot to say. So yeah.
Thank you, Yash. And if Alad or whoever's doing the presentation doesn't mind, if you wouldn't mind bringing that back up just for a couple of moments, I want to point out one particular slide that Yash had made. If you scroll back up to it was like a supply chain picture with a kind of a distribution network. And while he does that, I just want to again thank Yash for inviting me to be the discussant, and Onero, of course, for hosting this discussion. And Yash, one of the key themes that you brought up throughout your presentation consistently, one of the things that I'd like to present is this theme of collaboration and cooperation. No one entity is going to be able to solve their problem themselves, and it's only through cooperation and collaboration that we're going to resolve any issue. In this case, that's global vaccine distribution and preventing and responding to this pandemic, but preventing future pandemics going forward. In this distribution network, I mean, I love the way that this was presented because it's simple. It shows arrows going from here to here to here. How do we get the vaccine from the starting point to the people who actually need it? And just to kind of introduce this concept of collaboration, the vaccine in this picture is flawed in that vaccine production and creation and everything revolving around vaccine multilateralism at the end of the day doesn't start in just the factory. It starts with the initial need for it, responding to that need, governments coming together, deciding how we can fund private companies to research and produce this vaccine, otherwise producing it in government research organizations themselves. And then once that process takes place, once we have the research for that vaccine, we're ready to manufacture, then it can start in these factories for production. And that process takes forever. And historically, vaccine production has taken years. In Operation Warp Speed's case, we were able to, minimize that at a record-breaking time. But traditionally, this process of cooperation takes a long time. And that's why increased cooperation, increased collaboration can only help to mitigate, to reduce that time and improve the health and improve our health infrastructure, improve our economic infrastructure going forward. And then just looking at the infrastructure that we would need from its actual manufacturing, we would have to have, as Josh pointed out, trucks and other mechanisms along this cold supply chain to deliver these vaccines, whether it be trucks with freezers in them or these distribution hubs that have freezers in them, or these freezer farms. And then once you actually get them to the hospitals or pharmacies or local clinics, wherever they exist, anywhere in the world, does that hospital have the infrastructure to hold them and keep them cold for a long amount of time? Do they have the workforce and the training to actually use these vaccines? Are there trained personnel, whether they be doctors or nurses or whoever, qualified enough to give these vaccines and manage the administration of just running a hospital? Those are questions you have to ask yourselves. It's not just getting the vaccines where they need to go. It's also ensuring that we're collaborating on all these other mechanisms, whether it be the global supply chain or lab training, as I talked about last week in my discussion on containing pathogens. Do we even have the research labs in place to research future pandemics as they arise? And are those or do we have equitable access to those around the world? We discussed last time that there are only 60 high-profile labs that can discuss the most dangerous pathogens like Ebola. Only three of those 60 are located in Africa, where presumably the largest need for a bolstered health infrastructure is located. So if you want, Alad, you can cancel out that presentation. I just wanted to bring up how much collaboration it takes along the global supply chain, even starting from before manufacturing to the point to where it's actually administered to a population. And then after that, one of Yash's crucial points is kind of this theme of collaboration. Fitting into that is this COVAX initiative and all the different actors that make up the COVAX initiative. It doesn't just take one actor. It takes CEPI and Gavi, the WHO, UNICEF, and all of these different entities to work together to ensure that there's funding, to ensure that there's contracts, to ensure that there's vaccine manufacturing. And then they have to collaborate and work together to ensure this big multilateral initiative a lot of link to the research there. But it takes all of this cooperation to get from place A to, at the end of the day, place Z. And COVAX in and of itself, as Yash pointed out, is a process that's going to have to take years. And we can try and do everything we can to expedite that process, but what we can do to expedite that process is only increase multilateralism. By being selfish and focused on nationalism and internal initiatives, we're preventing these bolstering of economic infrastructure and health infrastructure overseas, which at the end of the day can only protect internal economies. It only takes a disease 24 hours to travel around the world, right? And once it originates on the other side of the world, you need to make sure they have the infrastructure to stop it there before it can spread around the world. So it truly is a global process of the entire vaccine distribution and administering kind of process. It's a global process. So on top of that, by the end of 2021, this COVAX initiative is only slated to make 1.5 billion doses and have those available to 92 economies. And whereas COVAX has done the right thing and kind of set out these 1.5 billion doses for low to middle income countries, these LMICs, there's only 92 countries that have access to this 1.5 billion. Presumably the high income countries could already afford it and pay for their own. In this case, 1.5 billion will be designated here. And by the end of what they have scheduled, they're slated to create 5.1 billion doses for as many people as they can give them to, or sell them to rather. And at the end of 2021, these 92 economies that are going to be affected, that corresponds to about 20% coverage in each individual economy of those that will have access to the vaccine. And among that 20%, just because they have access to those vaccines doesn't mean they will use them. And we've seen the biggest problem in the United States has been vaccine hesitancy. Just because we can get vaccines overseas doesn't mean that those populations, one, have the infrastructure to use them, as I've already talked about, and two, will have the willingness to use them. Vaccine hesitancy is a global problem that exists around the world, and you need appropriate mechanisms to address both of those. And that all takes cooperation and collaboration. It takes transparency from international institutions like the people involved with the COVAX initiative and research organizations that are providing transparent data and communication from the top down, communicating the pros and cons of the vaccines. So all of this is just kind of a give and take of information that's all necessary. And I'm trying to see how much time I got here. I'm running low on time, but the last thing that I wanted to say, and besides all these uncertainties, whether it be manufacturing, regulation, funding, contract terms, the country's actual readiness to begin vaccination programs, the last thing I wanted to say is that domestic politics also plays a role in this multilateral initiative. You have, in order to even get something on a global scale, to collaborate with another organization, entity, politically, economically or at the health level, you need a willingness in that one individual, in that one entity. And domestic politics around the world are affecting those dynamics at that individual level. Here in the United States, we have kind of this warring faction set up within the government and between the government and its people that are preventing any kind of resolution to be made on who we're supporting. You know, that might be illustrative of Donald Trump's pulling out of the WHO or earlier on in the pandemic, or kind of Republicans and Democrats disagreeing on who should have access to what, or how much funding we should give and who should have access to that funding. And internal politics plays just as much of a role in preventing vaccine multilateralism as actual cooperation between those entities themselves. So again, my big takeaway is collaboration. And now after kind of my spiel, I just wanted to, I guess we can get started with like this Q&A. So Yash, I'll ask you the first question that I have for you. The biggest problem right now we're facing, of course, as you pointed out, is this Delta strain and other strains that might, you know, pop up as this pandemic progresses. So, well, I guess what I'm curious about, when you have these low middle income countries who are still struggling to get access to the original vaccine, and then you have these high income countries that have access and they're already talking about getting booster shots, and some local counties are already administering booster shots. You know, how do we decide global vaccine distribution and its implications with Delta strains and new strains that are arising every day?
Oh yeah, for sure. I think Delta. I think. Sorry, Jared. Can you mute yourself? I think I could hear you. It's kind of weird. Sorry. But yeah. So I mean, Delta obviously is of great concern right now. Those are, I think, it accounts for like what 83% of total infections today in the U.S. and a lot of the other countries like Israel, UK, et cetera, are also dealing. They have high vaccination rates, but they're still dealing with the strain, and vaccinated people are getting infected and they're infecting others. And the big problem is the R0, which everyone's concerned about. But what I will say is that the CDC has brought this up. Biden has brought this up. Many people have brought this up. They're saying Delta is the pandemic for the unvaccinated. And by that, what it means is that for the vaccinated, you don't see many breakthrough infections, which means that you don't really see many people being hospitalized for or really facing really severe illnesses because of Delta. So we're just, you know, spreading in that sense, where the best thing to do is just mask up, stay safe, try not to go in crowded areas, of course, and try not to spread to other people if you have symptoms, and you should, you know, whenever. But the deal is that you don't really see people going to hospitals because they are vaccinated. And what I will say is that while this is going on here, where you have people who are vaccinated, there's still a lot of people in these LMICs, these low and middle income countries, that they just don't have any vaccination. And recently, the WHO put out guidance saying, hey, let's not give people booster shots in these wealthier, high income countries until the end of September. Sometime in September, early October, even. I would even suggest push it back to November, because like the goal is to get at least 10% of each country vaccinated until you start giving people booster shots. And we're like, a lot of these countries in Africa or even South America or Asia, you're just not even close to that goal yet, and there's still a long way to go to get there. So I personally, my recommendation would be to hold off on the booster shots, because it's not Delta's not causing the vaccinated to go to hospitals. I would suggest keep rolling out vaccines for the unvaccinated, and then and in the countries that are high in and give the vaccines to the other countries, and then give the booster shots, because that way, you know, it's going back to that hybrid approach where you can have the natural tendencies and take care of your own population, but also look out for the global side of it and how what's happening in your country is affecting other countries at the same time. So that'd be my guidance. You know, I agree with the WHO in that sense, where I would suggest, you know, just waiting until the end of September, October, because it's not really sending people to hospitals right now. So yeah.
Yeah, and I totally agree with that. You know, my biggest thing after listening to that is, you know, the WHO, at the end of the day, the goal is to get 10% of the entire population in each country vaccinated, right? And the WHO has just recently decided that there's going to be this moratorium on booster vaccines, or kind of these booster doses until September. That's a month away from now, and to me that just seems kind of like an arbitrary number. In 1 month's time, then we'll be able to have booster vaccines. Well, where did they get 1 month? There are still countries out there who it's going to take several months, if not several years, to get them the vaccines before they can even have access to these booster shots, which will come later, presumably, for them. So it's kind of a complicated situation to navigate the public health initiative of one country and their internal situation, whereas we're ready for booster shots maybe among our population. Could that, in fact, give quicker rise to different strains, especially because the more kind of resilience that we have towards a strain, that might give rise to another one, and then that would cause a problem internally for countries overseas who didn't even have initial access to the initial vaccine. So it's a complicated situation. Yash, do you have any questions for me to ask?
Yeah, so I have two. I will hopefully have time. I have a couple of questions, two in particular. So the first one, obviously we're talking about Delta and things opening up, even with this variant going out, people getting ready to go back to school here. Events going on, concerts, et cetera, et cetera. And with the Delta, there's been a sort of normalization of the pandemic here in a lot of Western countries with more tourism and stuff like that. And my sort of question is, with the normalization of the pandemic, how do we continue to pay attention to this pandemic and other health crises in low-income countries as it continues into 2023, 2024, when we're sort of getting to the end of it, or like probably done with it by then? So yeah, how do we deal with that?
Yeah, so again, it's complicated because each country has, we're on their own level of response. Some people are still reacting to it. Some people are actually in a place to where they can respond to it. And then some countries are just like, they have nothing and are still dealing with the fallout from nothing. And that can only get worse, presumably. But the normalization of how we respond to pandemics should really be a top-down approach. It should start at these multilateral initiatives like COVAX, and filter down and trickle down into the government level for each country. And then that again should be communicated down to the local populations, the local, tribal, state territories, and then again down to the individual like you and I. And that's a difficult thing to do, because what we demand from the bottom down approach is transparency, correct information, correct communication, accurate information. And historically throughout this pandemic and pandemics prior, that's been the biggest challenge, is health communication and health education from a top-down approach, especially when you have big multilateral initiatives or institutions like the WHO in the case of this pandemic and the Ebola pandemic in 2014, 2015, giving different information, giving wishy-washy information on how to respond to something in particular. And then the population sits there and questions like, is this the right thing to do? Or is this not the right thing to do? I'll give you a specific example. And early on in this pandemic, the WHO said, don't worry about wearing masks. At this time, we can't even produce the amount of masks that everybody in the world would need. On top of that, they're unnecessary because they're really only effective when you implement other mechanisms anyways, like social distancing, and they might even produce more risks as people are taking their hand, which could be infected, moving it in and out of their mouth all the time away, putting their mask on and off. So initially they recommended not to do that. As the pandemic went on, that shifted, saying everybody needs to wear a mask, indoors, outdoors, whatever. And this shifting mentality of what do we do to respond leaves the individual wondering, is this a trustworthy source of information? On top of that, you have actors who are deliberately producing misinformation about how to respond to pandemics. You have people who are COVID deniers, disease deniers, groups who are kind of put up on a pedestal this idea of vaccine hesitancy, and they spread it around as if it's actually a healthier concept. The government really needs to deal with, how can I communicate to my population what's correct? And then and I'll give you another example too. The Nuclear Threat Initiative produced a report called the Global Health Security Index, indicating kind of on each country level a score for their ability to prevent, detect, and respond to disease. One of those indicators, interestingly enough, was does the local community have trust in its government? Does it have confidence in its government? And to me, upon first reading that, I was like, why is that important in a pandemic? But then I'm realizing the people who are responding to the pandemic are often at the public level. They're the health agency workers, the administrators, and the diplomats who are organizing this distribution of vaccines and personal protective equipment, et cetera. And truly, if a population doesn't trust its source of information, you're going to have a mixed reaction. So when it comes to like the normalization of this disease, I would just suggest to for a top-down approach that focuses on transparent communication and efficient health education. And just for a funny anecdote, in France, President Macron has decided the best way to do that is to go on his Instagram and post Instagram reels of him in a t-shirt saying, here's what the vaccine does for you. This is exactly where we went. That may not be the best top-down approach because it seems a little cliche and insincere. So again, that is one solution that countries try to come up with is these Instagram reels from their president. So hopefully we can find a better way to communicate that top-down approach so that people don't normalize it.
Yeah, I completely agree with the education part of it, especially. And I guess my second question, I know we're running out of time, so I guess just keep a little bit brief, and it's hard to keep this brief because there's so much to unpack and talk about. But just especially since the start of the pandemic, there's been a lot of criticism of the WHO. I want to talk about their role in the pandemic and what they've done good, what they've done bad, what they could have done better. So I just wanted to know what you think, what they could have done better in terms of COVID, and what kind of mechanisms / what should the WHO do in preparation in the event of future pandemics. So yeah, thanks.
So the first thing, I'll just point you back to what I just said about this top-down approach of communication and being accountable for your own actions. That's something we didn't see in 2014, 2015, the Ebola epidemic in West Africa. The WHO was late to respond, late to call the epidemic a public health emergency of international concern, a FIEC, essentially yelling to the international community, let's respond to this now. And you'd think there have been some lessons learned from that epidemic, this last epidemic, that would translate into their response to COVID-19. And I like to call this, in the US's response to that, to WHO, I like to call it kind of the SpongeBob phenomenon. And then we're just kind of shaking our fists saying, how many times do we have to teach you this lesson, old man? That's kind of feels what the US is doing to the WHO and a lot of other countries. When it came to COVID, back in December of 2019, when we were made aware, when the WHO was made aware of a potential virus that was transmitted around Wuhan, there was no reaction until a month later in January when they declared a FIEC. And then it took 2 months after that in March before the Director General called it a pandemic. And March, we all remember, is when everything was getting shut down. We were getting sent home from study abroads and schools were closing down. And it wasn't until then that it truly felt like a pandemic and the response was like truly administered. And then it took a year after that, an entire year after that, for the WHO to actually send an investigation team into Wuhan to research, whether it was an intentional outbreak, whether it was unintentional. And because it took a year and it wasn't transparent and it wasn't communicated quickly and efficiently, that caused all these theories and misinformation about COVID origins to kind of propagate around different communities around the world. And so, we keep shaking our fists, like saying, why aren't you doing it quicker? Why aren't you doing it sooner? So that's the biggest criticism, is take those lessons learned and actually implement them. At the same time, whereas they have been late to respond, they've also been efficient to mobilize COVAX. They've been efficient to mobilize this global vaccine distribution. And there's even talk that they would be recipients of a Nobel Peace Prize. So, whereas we can criticize WHO, I don't want to advocate for calling them out. I would advocate for taking all these international institutions who are working on this and call them in and say, here are the lessons we've learned in the past, historically. Let's take these lessons and let's change it going forward, and cooperate. Back to the initial theme of the discussion, cooperate and collaboration is what it takes to prevent pandemics in the future and to stop this one right now. And I guess with that, I'll stop our discussion on that key theme.
Yeah, obviously there's a lot to unpack here. There's still a lot to do in terms of this pandemic. But going forward, hopefully, I guess, final words would be, hopefully we're able to put in those mechanisms in place to have more multilateral initiatives or have more collaborative efforts instead of what we saw at the beginning of this pandemic, where people were hoarding supplies or countries wanted to do this or do that, and there was just like hardly any structure to it. And it's obviously COVID-19 is going to be a case study going forward, and about what we should do for global health governance. Yeah, because these problems are not going away, and that's just how it is. And with that, I'll turn it back to Alad. Thank you guys so much. Really appreciate it.
Thank you so much, Yash and Jared, and thank you to all of you who have been here this morning with us. We're about to send you all off to lunch, but before we do, I just want to go through some of the next things that are going to be going on. We have lots of phenomenal content and activities here today, and I really hope to see all of you there. So again, thank you to our speakers. We had Shelley Lim before, Michelle Pavlchak, and Maria Rojas, who spoke about climate change and health equity. Thank you to you two, Yash and Jared, for a phenomenal discussion on vaccine nationalism. Once again, I'd like to just plug Yash's article. It's right there in the chat. Make sure to go and give it a read. He did a phenomenal job on that, and we can't wait to see what's next from him. And thank you again, Jared, as well, for doing a phenomenal job in our event last week. After this, like I said, we're going to pause for a lunch break. Then at 1:35, for those of you who are members of Onero in the Onero community, you should have received an email with a separate Zoom link. This is the only Zoom link that's different. Everything else is with this same Zoom link. For a Onero community activity. It's going to be a fun time for the organization to kind of get to know each other a little bit better, hang out, and do some activities together. We'll open back up to the broader summit, where I really hope that all of you will join at 2:15 p.m. today. We'll be having a Young Professionals in International Affairs panel that's going to include some great speakers who are just out of college, similar to Jared, just out of college and now working in the field of international affairs. I would have loved to have Jared on this one too, but he's already doing so many things for us already. So I'll give you a break here, Jared. But we're going to get some great speakers. So we have Christopher Kim, who works with Atlas Crossing. We have Max Kaplan, who's working in local campaign, and we have Cecily Fasanella as well joining us. So be sure to catch that at 2:15. Then we will have the next session with more presentations at 3:15 p.m., beginning with Maria Alessandra D'Agostino, talking about understanding FGM in Sudan and around the world. And so with that, I'll leave it there. Thank you all for being here today. I cannot wait for the rest of this summit and the rest of the activities today. Have a great lunch, and we'll see you again really soon. Take care.